Hey everyone, this is James Roguski, and this is an urgent plea for everyone watching this video to help Dr. Ron Elfenbein avoid an absolute miscarriage of justice. Ron Elfenbein is being charged by the Department of Justice in the Trump administration for miscoding 5 accounts out of hundreds of thousands of people that he treated during the COVID-19 event. And this video is to get people to help spread the word so that many more thousands and even millions of people understand just what your government is capable of doing to someone who really is a hero. And if they can do this to Dr. Ron Elfenbein, they can do this to each and every one of us. Now, what I would like everyone to understand is that there is, and I should say, there are actions that you can take to help Dr. Elfenbein to have his case dismissed because, and I encourage you to watch this entire video and read all of the information down below in the article. I personally am just absolutely astonished and disgusted by what our government is attempting to do to this fine man. And so I'd like to introduce you to Dr. Ron Elfenbein. Ron, if you would be so kind, explain to people how this all came to pass.
Thanks for having me, Jim, and thanks for letting me tell my story. So, I am an emergency room physician. I trained at Johns Hopkins. I grew up in New York, and I moved to Maryland to do my residency at Johns Hopkins. And I stayed there because my wife also was doing her residency at Johns Hopkins, and we decided to stay. She's still at that facility. I am no longer there, but that's where I trained. So I started a small urgent care center because I'd always wanted to provide better care than I thought was being provided out there. And by better, I don't necessarily mean better medical care, but better overall care. To look at more at the holistic care of the patient and the patient satisfaction and things like that, really providing excellent all around care. And that was my goal. I never actually worked at the facility. I was just a medical director. I hired nurse practitioners and PAs. And it was running along fine from 2016 until 2019. And I started to, like everybody else, I was watching the news and I could see what was going on overseas. And despite what the CDC and the FDA and the CMS and every other three-letter agency of the federal government was saying, which was that this virus is not going to come to the United States, I was like, well, there's no possible way it's not coming to the United States, especially when the footage that they were showing was of people being boarded up literally in their homes and of like tanks with their turrets pointed into the city. And I'm like, okay, I can believe you or I can believe my lying eyes. Which am I going to believe? So um, I started to prepare and I started to purchase as much personal protective equipment, gloves, masks, gowns, whatever I could get my hands on, because it was hard to get at that point and became harder and harder and almost impossible later on. And testing supplies because I knew we would be doing a lot of testing. And then literally, March comes around and the world shuts down. And I was literally on an airplane, and the day later, flying home from somewhere, the next day, they shut the world down, which was just very crazy and ironic. But um, so I started to think about what can we do to help. And as a physician, you take an oath, and as an emergency medicine doctor, like this is your time to shine, right? I mean, it doesn't get any better than this from a this is what I trained to do perspective. Unless it was like a mass casualty event or something like that, this is what I trained to do. I mean, I'm not a virologist, I'm not an epidemiologist. I'm a boots on the ground, like, fixing people, making them better right then and there. And I thought, well, how can I put my skill set to use? So I and I said, listen, I took an oath, and I take that really seriously. I know that sounds corny, but it's the truth. I really do, and I just wanted to step up and do the right thing because, again, like I was going to think 50 years from now, looking back on this day, did I hide in my basement or did I step up and do the right thing? And I was like, there's no way I'm going to not be the guy stepping up and doing the right thing. So I started to prepare my staff and I started to explain what I knew about the virus, which is very little because nobody knew anything, but what I understood. I started to become in my own head, at least, an expert on PPE, personal protective equipment, how to put it on, how to take it off. I started to study all that stuff. Um, I started to find out which is the best products, which are the worst products, and I just dove into supply chains and I started to again purchase what I could. And I realized very quickly that other places didn't have them. So I started to, we had an ample supply. So I started to donate this stuff. I started to say, well, we have, hundreds of gowns. I can afford to give some away. So I gave them to nursing homes and I gave them to doctors in the area and I gave them as far away as Connecticut and New York. Um, a buddy of mine is a cardiologist in Manhattan and he was literally wearing a hefty garbage bag. He called me and he said, he's like, he's a cardiologist and they drafted him to work in the ICU at a major academic center in Manhattan. And he said, I don't know what the hell I'm doing. How do I not kill myself? How do I not get this and die? So I spent 2 hours on the phone with him explaining the procedures to follow and what to do and make sure he was okay. And I said, by the way, there's a care package coming for you. And it was all gowns. And he also told me, well, we don't have face shields. So I sent a whole bunch of face shields. And then I found a friend of mine who has a 3D printer. And we found an online source where they could make the piece that goes around. So we started making 3D printed face shields. And we started donating those to anyone who needed them. In fact, the Drug Enforcement Administration actually called me up and said, this was very early in the pandemic, but they said, we have a major drug bust to do in Annapolis, Maryland. And, we don't have any PPE. The federal government cannot provide it to us. Can you please get us some? So I know it's very ironic. So I said, sure. So we asked them, what do you need? And they said we need gowns and masks and whatever. So the special agent in charge came to my house and picked up what he needed and texted me the next day with pictures of all of them with their hands around each other saying, we executed our drug bust. Thank you very much because of you. Um, and I don't say that to pat myself on the back, but we had the supplies, so we wanted to share them with other people, so we did. And then, we were like, well, how are we gonna manage these patients? How are we gonna get them with the care that they need? So I thought about it and I said, well, our facility is a fixed site, so we got to use what we have. So we were the first in the state and probably the first in the country to come up with the idea of the drive up testing. And I know that because we were on the front page of the newspapers in the area saying, look at this great idea. And basically, it was the patients would come in their car, and our providers, nurse practitioners, and PAs could stay inside, and everything was done over Skype. They could see the patient through an iPad that we would hand them, and then sanitize in between patients, and that worked for a while. But then we became so big, and so many people needed our services that that didn't work. So we had to keep changing and changing, and the one site that we had was no longer sufficient. So we went from one site throughout the pandemic to 8 sites at one point, and we had from six employees to over 300 within about 12 months, 12 to 14 months. I mean, it was just exponential growth. And it wasn't because we were, Warren Buffett's and geniuses at business. It was because there was a need, and we were solving that need. We were providing a service that people needed, and it was crazy. Like the first site that we had, it sits on a major highway and we would open at 8 o'clock in the morning and people would line up at 4 a.m. And we had to figure out, and it's backing up a mile long. I'm not exaggerating. Well, actually, over a mile. So we had to figure out how do we stop that because the people were getting angry because he would block traffic. So we had to say, all right, well, we're going to hire off-duty police officers. So the off-duty police officers would show up at 3 o'clock in the morning and they would sit out there and they would direct traffic and they would work for us for hours. And then, we didn't want our staff staying until midnight, so we had to close the line at some point. We had to figure out a way. Well, how are we going to stop people from coming after a certain time? And we don't want to turn them away once they're there because they've been waiting for hours. So we had to figure out how to deal with that. And then testing supplies. We were always running short of testing supplies. It was a constant battle on the phone with various suppliers. And one day we would use this brand test, the next day would be a different test because it was just a constant whatever we could get our hands on. And it was each test worked a little bit differently. So we had to train our staff every single day on a different test, which was difficult to do. And we went from, like I said, from one site to 8 sites. We had mobile sites. We had, we figured, well, there's some volunteer fire departments that aren't using these catering halls and they're huge parking lots. So we went and we basically said, this is a win-win. We will rent the space from you that's not being used. And you get a check every month, and we can provide a service to the community that's not being provided anywhere else. So it was a win. And then monoclonal antibodies became available, and I was a very, very early adopter and an outspoken proponent of their use because I recognized that this technology, unlike the mRNA vaccine, I want to make this clear, which was a new technology and hadn't been tried. This was a tried and true technology that's been around since the early 70s. And it's used to treat all sorts of ailments. It's used to treat autoimmune diseases, certain types of cancers, various other infectious diseases. So this was the technology that we knew worked. It's very safe. There's really no major side effects from it, and it's great. So I was out there just beating the drum about how wonderful this was. But the sort of the other side was out there beating the drum about the vaccine. And I didn't really understand that. I said, well, why are we only talking about the vaccine when we have this cure, which really is a cure? I mean, people could come in and it's an IV infusion, you drip it in through the vein, and in 30 minutes, and they're cured of their disease right then and there. And but nobody wanted to listen to me. They were just talking about the vaccine. And I was on the news talking about this, and I was like, I don't understand. Why are we only talking about the vaccine, which definitely has a niche for its use, but we have a cure. Why are we so gung ho vaccinating everybody, including babies and infants and people who were just recovered from this virus when we have a cure? Like, it doesn't make any sense. It medically didn't make any sense to me. Um, so we actually, one of the major problems was you couldn't get monoclonals because, and by you, I mean the patients just couldn't get them because they made it so onerous for people to give it, which also boggled my mind. So I said, all right, well, what's the pain point? Why are people not getting it? And the reason was at least in Maryland, I can't speak to the rest of the country, but in Maryland, if you wish to get monoclonals, let's say, Jim, you were a patient of mine in the emergency room, and I said, Jim, you just tested positive for COVID. You're sick. You meet the criteria to get, I think you should get monoclonals. What I would have to do would be go to a separate website outside of my electronic health record, put in all your information, fill out like 3 or 4 pages of just various questions and answers, whatever, print it, and then fax it to some number on the hopes that they would eventually call you and set up an appointment for you, which never happened. And no doctor has the time to do that. You're talking about 30 to 40 minutes per patient to fill out all this paperwork and fax it and all this other stuff. And of course, nobody's getting paid to do that either. So there's no incentive. And I hate to say that, but that's just the truth for all these busy doctors, be it in the emergency room or your primary care doctor, to do that. So nobody was getting this life-saving medicine that we had ample supply of. So I said, okay, well, how do we fix that? I set up a call center and I trained the people on the, they could stay home, and I gave them a phone and I said, here's what you do. When they call, here's a question and answer thing. You're going to walk them through. I gave them a script. I said, this is what you follow. Any questions, call me. And all of a sudden, we were infusing 50 people, 100 people, 300 people, 500 people a week. And we needed more space. So we went from one infusion site to another infusion site. And then the federal government actually called me, HHS, the Health and Human Services Department of the federal government. They said, you know what you're doing about these monoclonals. We'd like to open up a site at FedEx Field where the Washington Redskins play football. Could you do this for us? They said, absolutely. So I was very excited about this. I did it in partnership with my company, HHS, and the Maryland Department of Health. There was a church right at the base of the football field, basically, and they gave us the space. And I made a list of what we needed and supplies we would need, and they basically gave us carte blanche to buy everything. So we went out and bought all this. And by the way, I have no experience with like infusion centers. I don't do this for a living. I'm an ER doctor. So I had to teach myself how to do all this. What kind of chairs do you buy? What kind of monitors do you need? What kind of IV tubing do you need? Just silly things like that. I had no clue. So it was all research and learning, and a lot of it was trial and error. We buy the wrong product, have to return it, or just donate it somewhere else because it didn't work. Um, but anyway, so we opened up the site. We ran it for over a year with partnership with HHS and the Maryland Department of Health. And I went to the feds and I said, listen, we should be testing here too. And they said, no, 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 we don't want to test. We just want you to treat them. I said, well, the beauty of the test is that it's a rapid test and we can test somebody. And if they're symptomatic and they qualify anyway, we would tell them to wait in their car for the results. And if it was positive, we could literally take them from their car, with their positive COVID diagnosis, and walk them to a chair, put them in the chair, and literally the stuff just drips into your arm over 30 minutes, and we would cure them right then and there of their disease and make them not infectious and better. And I'm telling you, I saw a 103-year-old walk in, well, had to be wheelchaired in. He was almost this color of my shirt. And halfway through the infusion, he started to get more color in his face, and he said, "Wow, I feel so much better." And he literally walked out. He went from having to be wheelchaired in to walking out, and that was not unusual. This happened to be an extreme because he was 103 years old, but that was not an unusual experience. And I will tell you, we built three of these sites. If I could have found the staff and the facilities to do it, I would have built 100 of them, because this was the cure for this disease process. And it was remarkable and unbelievable. And they being the powers that be, just did not want people to be able to get this. For whatever reason, they made it very difficult for everybody to provide it. And the way it worked to order it was the state, well, they would approve you. So in my case, it was Maryland. They approved us to be uh, a distributor, basically, of monoclonal antibodies. And they would give you a PIN number, and you'd log into the distributor's website, and you would order what you would need for the week. And literally within 12 hours, you would get a box, a refrigerated box, FedEx to you with whatever you asked for. Whatever monoclonal you asked for and however the quantity was, you would get it. No questions asked, no problem. You just had to, sign your name that you were going to use it, you weren't going to sell it, things like that. Well, then the administration decided to start politicizing it, which I'd never seen anything like that in my entire life in medicine. And by politicizing, I mean, first they said, we're going to take over distribution. We're going to federalize this. And what that did really was create artificial shortages overnight. So when I said before, all I had to do was log into the distributor and get whatever I asked for. I asked for 100 doses, I got 100 doses. Now, literally the next day, okay? It's not like they ran out of the stuff, but literally the next day, you asked for 100 doses, you were lucky if you got 60. And uh, but we were the largest in the state of Maryland. We were, in fact, the largest user in the entire Mid-Atlantic region, Maryland, Delaware, uh, Pennsylvania, Virginia, West Virginia. We were the largest. And we could thankfully get it, but we were getting reduced quantities. And then they said, well, we're going to start using quote unquote equity as a means to determine distribution. And I frankly don't even know what the hell that term means. I don't think anybody does. There's no real definition that I've ever heard that makes any sense. And it certainly makes no sense in a medical setting. When you're talking about a life-saving drug, it should not be about what's quote unquote equitable. Again, whatever that term means, it should be about what is necessary. What do patients need? And what do the physicians and the people that are looking at these patients determine is necessary? But that's not what happened. They said, we're going to use equity. So I'm going to use Florida as an example because it's a great example. There was a major outbreak. I believe it was the Delta strain at the time in late 2021. Florida was cut off. They said it's not equitable. We're not sending it to Florida. We're going to send it to other states instead. So you're literally consigning people to die because of some bogus term that the government wants to use to determine, for the first time in medical history, who's going to get this medicine and who's not. So they started sending it to other states, and it just so happens that most of those states that got quote unquote cut off seem to be, at least to my recollection, red states. I can't prove that, but that seems to be what my recollection was. And Florida being which is crazy, is the most at-risk patient population who's having an outbreak of people sick and dying. They got cut off at exactly the worst possible time they could have done that. So I went on the news and I started yelling and screaming about this because this was totally wrong and totally unfair and counter to everything I'd ever been trained to do as a doctor. It's un-American, and it made me very angry. Um, but I think overall, like, just getting all this up and running was just a logistical nightmare. It was every single day was another fire to put out. And I was on this thing, I'm not exaggerating, on my cell phone 24/7 for 2 entire years. I didn't see my family. I was working in the ER also, and I was picking up extra shifts because people didn't want to go in the ER. So I was picking up extra shifts, and people meaning doctors. So I was trying to make sure there was people working. And in fact, I picked up at other hospitals too, not even the one I normally worked at. We're going to other hospitals. Um, and I was constantly on the phone dealing with a fire. I mean, for example, I told you about the line that we had that was a mile long. And that wasn't just at that one site. We had other sites, and it was the same thing at every site. We had to hire off-duty cops at every site. And, People are waiting in line for 5 or 6 hours. They got to go to the bathroom. How do you solve that problem? So we had to have, oh, well, all of a sudden people were like, what do we do? So I said, well, we got to call one of those companies that brings in a porta potty. So we had porta potties. And then how do you keep the porta potty clean? And how do you make sure people don't get, contaminated when they go in and out of the porta potty? So it was like one thing after another of just constant thinking outside the box, fixing a problem that you could never have imagined coming up, but that was there. Uh, Again, the IV tubing issue. Like at one point, you couldn't get IV tubing. So how are we going to give monoclonal antibodies without IV tubing? You couldn't get normal saline. You couldn't get IV fluids. So how are we going to do that? How are you going to administer the medicine? Because it comes in a little vial. You got to mix it with saline. How do you do that? We couldn't get gloves at one point. I literally, no exaggeration, found a vendor. I think it was in Korea, and they had gloves. We had a pallet, an entire pallet of gloves delivered. It was like 80,000 gloves because that's all I could get my hands on was 80,000 gloves. So I said, just we're going to buy it. And we had to rent a storage unit. We had to, I mean, and it was just crazy. Like every day was another problem like that we just had to figure out how to do it because the supply chains were so tenuous and there was really no help from the federal government. Um, so it was just figure it out on your own and do the best you can. And that's what we did. And I'm very proud of the work that we did. And I'm very proud of everybody who stepped up to try to do the right thing.
Now, Ron, you were rightfully viewed as a hero. You accomplished quite a lot of very good things during the COVID crisis, but that didn't really seem to matter to the federal government.
So, in recognition of all that, the governor of my state at the time was Larry Hogan, and he came and personally gave me a citation at one of my facilities. He showed up and handed to me a personal citation that said, you're for all your heroic work during COVID, the people of the state appreciate you, that kind of thing. And the state legislature voted to do the same thing, and I got a personal commendation from the state legislature. I actually testified in front of the legislature at one point as well about COVID. And then the State Medical Society named me its Person of the Year. And I got that award even after I got indicted by the federal government, which I think is pretty telling. But this was because I was literally not, I was doing everything I possibly could to help as many people as possible. And I know that sounds corny, but that's the truth.
What would you estimate? How many people overall did your organization give healthcare to in the period of time that's under question?
So over the course of the pandemic, we saw over 300,000 patients. Now that includes testing and monoclonal antibody treatments. During the course of the indictment, we saw over 100,000 during the time frame that they alleged that there was wrongdoing. Um, Overall, we saw over 300,000 people in a little over whatever it was, 2.5 years, something like that. Um, and probably, I don't have the exact numbers, but I think for the infusions, we probably infused over 5,000 people with monoclonal antibodies, which again are the life-saving medication. And the number needed to treat on that is a statistic that we use in medicine is so low that the impact is enormous. Meaning, just so your audience understands what that is it's if you take a group of people, how many people do you need to treat with a certain medication or intervention in order to achieve a desired outcome? And in this case, that desired outcome would be not dying or not needing hospitalization, avoiding those two horrible things. So that number, depending on the monoclonal we were using, and depending on the time frame, and depending on whose data you want to look at, it's anywhere between 10 and 15, which is outrageously low for medical interventions. I mean, it's amazing. I've never seen anything like that in my career in medicine. So if we did 5,000, you're basically saying every 10th person, or at most 15th person, out of 5,000 people, uh, we saved their life or we kept them out of the hospital. So I mean, you're talking about thousands of people, and it's just, it's amazing, and I'm very proud of that. Again, to put this into perspective, this was a global pandemic. We were all fighting for our lives, what we thought, and on par, I probably saved the system hundreds of millions, if not into the small billions of dollars when you think about the ripple effect of what we did. And they're coming after me for this nonsense during a pandemic when people were worried about like dying. A simple billing dispute, then they could have just picked up the phone like any normal person and said, "Hey, could you explain this to us? Over five patients? Like, come on, what is this? It's crazy."
To be honest, I was completely shocked myself. I couldn't believe I had to read the document several times and actually talk to you to confirm that this whole fiasco is centered on five cases, five patients who were treated, and the government is essentially stating that you submitted the wrong ICD-10 code. It's just five patients.
So the government charged me with essentially upcoding, charging too much money, if you will, but we don't really charge money. We don't give you a bill. It's we use these medical codes. And just to put that into perspective, we use what's called ICD-10, which is a lexicon of codes. It's a huge thick book that the AMA puts out. And there are over 69,000 codes in that lexicon. So they said that even though I didn't see any of these patients and I didn't bill any of these patients, chose the wrong code on five patients out of a total of over 100,000 that we had seen, which I still just can't comprehend. But that's what they said, and that's what they charged me with. And uh, even more remarkable than that is we were billing what's called a level four code, which is a certain type of code. It doesn't really matter, but that's what we were billing it at. And I had perfectly reasonable rationale. I told my providers, here's why I think you should be billing this. There was no direction from the government, no direction from anybody on how to do that. This was an unknown quantity that we had never seen before, so we were just doing the best that we can. And I went through the charts that the AMA puts out that basically you walk through it and you score how to code and how to bill. And I said, this is what I thought we should do. And by the way, we also had a third party independent billing company and coding company that was working for us. But anyway, I went through that and I came up with what I thought was the most reasonable billing code. And I told my providers, here's how, what I think you should do, and here's why. So even if that's wrong, okay, uh, I would have, if they could have come to me and picked up the phone and just said, "Hey, Dr. Elfenbein, I don't understand why you build this way. Could you explain it to us?" I would have happily sat down in a meeting with them and I would have happily repaid some of the money. If that's what they thought, I would have argued with them and I would have said, "Well, here's my rationale." And that's what I think what any reasonable human being would have expected. Like if you go to the grocery store and you're buying strawberries and they bill you for 2 pints of strawberries, you bought one, or you think they overcharged you, you don't call the feds. You ask to speak to the manager or speak to the person, the checkout person, and say, "I think you made a mistake." Like any reasonable person would have done that, but that's not what the government did. And then, again, to make this even worse, if we were billing a level four, if you take the next lowest level, which is a level three, the difference between those two, I Googled this, so I know that on average is about $50. I say on average because every insurance company is different. So on average, the difference between a four and a three is about $50. So you're talking about $50 times five patients is $250. So you're talking about putting me in jail for 50 years and millions of dollars in restitution over what amounts to a $250 billing dispute. I just can't put it any plainer than that. Like, this is how insane this is. And I'm at the situation I find myself in. It's unbelievable. And I just can't explain how this is even possible.
I saw in one of the court documents that the government in various places claimed that you should have used the level one code, or they said you should have used the level two code or the level three code. Ultimately, you settled in on the fourth level code, which is not the most expensive, which is the fifth. But if the government can't decide for themselves what the right code is, even way after the fact, how in the world could they possibly accuse you of utilizing the wrong code? They themselves still don't know what the right code would be.
So the government actually had said at one point, maybe there should have been a level one. Well, level one doesn't exist anymore, first of all. And number two, at the time, didn't exist once a provider, a nurse practitioner, or PA sees a patient. And again, just to show you how crazy this is, there are people who do this for a living. They're called billers and coders. The government never went to the trouble of having a biller and or a coder look through these charts. Just government lawyers. So no one who knows anything about coding or billing ever looked at these charts, except on my side. We had past president of the American Association of Professional Coders. And he didn't just look at 5 charts, he looked at hundreds of them. And he said their coding was spot on and you guys did it exactly right. But the government never even had a professional coder. And again, your point, the level one thing, they don't even know what they're talking about. It's not applicable, completely not applicable. But they did talk about it at trial, and my lawyers completely eviscerated them on cross-examination, said it's not even applicable, it's not relevant. And their quote unquote expert witness was up there talking about, and it was not a biller or a coder, by the way, but a quote expert on Medicare. He's holding this book and he's waving it around and he keeps talking about it, how it's relevant. And on cross-examination, guess what that book was? A book on Maryland Medicaid, which isn't it had nothing to do with this trial. This was a federal trial about Medicare, not Medicaid. Totally different, completely different entities with completely different rules. And he was talking about, oh, this is this blah 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 blah. And my lawyers were like, could you hold that up for us to see? And it was like the completely wrong rule book. And and by the way, the people who wrote these rules that the government is accusing me of breaking is the American Medical Association. Now, I am not, nor have I ever been a member of the American Medical Association, but the American Medical Association wrote an amicus brief, which is a friend of the court brief, to the court and said, Dr. Elfenbein did not break these rules. And the government is still coming after me. And they are the ones who wrote the rules. You cannot make this stuff up. It's just insane.
The Trump administration Department of Justice is charging you with these, five miscoded accounts. And ultimately, in a worst case scenario, this could amount to 50 years in prison.
Each count is a real, like I said, is a real patient. It's a real human being that was seen, and each one carries up to 10 years in prison. So 10 times 5 is 50. So it would be 50 years in prison. Now, I wouldn't get 50 years in prison. I've never done anything wrong in my entire life. So I don't I don't have a criminal record. So I'd probably get a lot less than that. But theoretically, the judge could issue 50 years in prison and then millions of dollars in restitution. And as I said before, each one of those counts, I mean, it's over $250. Now, to be fair, it's actually in the government's eyes, it's more like $1,500 because they said that it's not 250. They don't even give us credit for seeing the patients at all, even though each of these patients that I held up their charts, they were seen, they were treated. They said, you don't deserve any money. You shouldn't get paid at all. So in their eyes, it's not $250. It's like $1,300 because that's what we billed for those 5 patients. Now, that's not what we got paid, and certainly not what I got paid, because you get basically in medical billing, you get about a third of what you bill for. So, but it doesn't matter. That's not how the government views it. They view it as what did you bill and not how much you got paid. What did you bill? And we're not even giving you credit for it. So I said before, we billed a level 4. Maybe they think it should have been a level 3. And by the way, the government never once said why level 4 was incorrect, how it was incorrect, and what the appropriate billing code should have been. They just kept saying, you, Dr. Elfenbein, are wrong and you're a criminal. That's all they said. And that was their evidence of a crime. Literally. I mean, that's why the judge just threw the thing out. They never explained what we should have, quote unquote, should have done. They just said it was wrong, which, again, on its face is insane. But that's the truth. So the government wasn't even willing to give us credit for actually seeing these people at all.
Um, it actually gets even more ridiculous. My understanding is that the Biden administration's Department of Justice filed the initial charges, and they never actually saw the files, the medical files from the patient accounts that they're charging you with miscoding. So since the definition of how you choose the code is based on the information in the patient's file, there seems to be absolutely no way they could have known in any way whatsoever what the proper code would have been, but yet they charged you anyways.
These are the patient records. I have them right here in my hand. These are 5 patients. Okay. I just want to say something very explicitly. There is real fraud out there. Okay. And typically, healthcare fraud is billing for things that don't actually exist, making patients up, for example, and just billing random patients that really never got seen or are made up. These are the real human beings. Their names have been redacted, but they're right here. 5 charts, 5 real live human beings that were seen that they charged me with. Three of them testified at trial and said, "I got seen. I got tested." I'm like, "Where's the fraud?" And the government charged me with the crime without ever looking at these charts. And I know that because the indictment came before the government had access to these charts, because I did not turn them over to the government until after I got indicted. Now, what's crazy about that is the billing is determined by what's actually in the charts. It's in these pieces of paper. That's what you base your coding and your billing on. So how could you possibly say that there was fraud without actually looking at the documentation first? It's mind-boggling and it's unbelievable, but that's exactly what happened.
Ron, maybe the only mistake that you made was that you spoke out against the Biden administration when they pulled back the access to monoclonal antibodies and wanted to distribute them based on equity. And you spoke out against that. And if you could go over the timeline of how shortly after that you found, an indictment directed at you out of the clear blue sky.
So I went and spoke out against the Biden administration starting in mid to late 2021. I started to question the vaccine narrative fairly early, and then it just got more and more progressive, and I started to speak out more and more. And I really spoke out at late in December 2021 when they shut the program down, and I really got angry. 4 months later, so in April of 2022, I was indicted without any warning. And I found out subsequently that, and I only found this out through discovery when the government has to turn over all their quote unquote evidence to you, that the government actually put people through one of our lines, like fake patients. Uh, I don't even know what you call them, like undercover agents through our lines. And they didn't even testify at trial. So wouldn't you think if there was some shenanigans going on and we were doing something that was untoward, they would have called these people and said, testify at trial. They would have called them as witnesses, but that never even came up, which again is mystifying. But again, that's the truth. And the only way I found out about that was because of discovery. And it was in there that they had put people through the lines that, were, and actually it was crazy. They wrote in their notes, yeah, we were seen in like 15 minutes, which is like, that's great. We had patients waiting for 10, 12 hours sometimes. Well, but probably not that long, 5, 6 hours to get seen and get treated because we were so overwhelmed. But that we became, as time went on, we became more and more and more efficient. So that was great that we could see them so quickly, that they didn't have to wait in line for so long.
My understanding is that there were a number of, let me just say, interesting abnormalities in the investigation leading up to your case. Can you talk about some of the things that the government did or did not do?
The quote unquote investigation that they did was not very thorough. And I'm not Sherlock Holmes and I'm not a detective, but to me, there's certain basic things that you would expect someone to do when they're doing an investigation. For example, they got my name wrong on all the charging documents. Now, Ron is not a difficult name. Elfenbein is. They got Elfenbein right. They got Ron wrong. And they gave me a middle name I'd never had. I don't have a middle name. Um, Again, you would think that if they're going to charge you with the crime, they would at least know the individual to whom they're charging. They didn't. They subpoenaed my personal Yahoo emails, but not my business emails, which I use to converse with most of the providers. Again, don't you think that would be relevant? So, like, there was just so many things that they hadn't done that you look at you like, how could you possibly say you did an investigation? So, anyway, we go into a pretrial conference. I was not there, but my lawyers were there, and the judge actually called out the government and said, "This looks like a case of quote shoot first and ask questions later." End quote. That's a direct quote from the chief federal judge of the state of Maryland who adjudicated my case in a pretrial conference. Even called out the government for their lack of thoroughness and lack of really doing a good job on an investigation. And I just can't explain how they charge you with a crime and destroy your life without actually having any evidence and actually doing a real thorough investigation. I just can't explain it, and it's awful.
The accusations that are being leveled against you and the trial that is scheduled is for coming up in August of 2026. But this is actually the second trial. And so could you explain how that all came to be?
So I find myself facing a new trial this August, and it's essentially a redo of the original trial because the chief judge of the state of Maryland who was an appointee of President Obama, by the way, and not some right-wing judge, but he issued this 93-page opinion acquitting me and guaranteeing me a new trial. And then literally as the clock was ticking and the days were winding down for the Biden DOJ and they were like packing up their boxes to leave, they decided to appeal. So I now face a new trial in August of this year, um, which is essentially just a redo, a do-over of the original trial. The courageous judge who wrote this 93-page opinion, which doing something like that is incredibly rare, I just want to point out. And he just completely tore the government apart and tore their case apart. He's supposed to adjudicate my new trial, but like 3 or 4 months ago, we get a one-line email that says, I am recusing myself from your case. That's it. Can't explain it. No explanation. I don't know why, because clearly the judge was so disgusted by what the government did that he wrote this 93-page opinion. Again, I so whether who knows why he recused himself, but recusal is a very specific thing. He didn't reschedule it. He didn't give it to another judge. He recused himself, which is a very, very specific thing, and I can't explain why.
In an ideal world, what would you like the Trump administration, Department of Justice to do in regards to your case?
The best resolution that I can think of would be for the United States government to drop the case and walk away. It's already been adjudicated by the chief judge of the state of Maryland, again, in a 93-page opinion where he tore the government apart and tore their case apart. I, just walk away from it. I don't understand why they're continuing this case. It's silly. It's ridiculous. It's already been adjudicated, and I don't understand what they hope to get out of this. Like, are they just that hard up for wins and losses that they don't want to have a loss on their hands? I don't get it. Like, so they're willing to destroy my life and my family's life again because they're that worried about their W's and L's. Like, it's just so crazy to me. So I think the best option, the best outcome would be for the government to just say, you know what, this is ridiculous. We just need to walk away, and we're sorry. We shouldn't have done this to begin with, and just go away. So I think if President Trump knew about this, he would just be like, this is crazy. We're just going to stop and walk away. That's what I hope to happen, and that's what I've been trying to get to happen. Finding somebody in the Trump administration who will be reasonable and will just put an end to this nonsense.
And Ron, last question, last but not least, how can people watching this video best help you?
Thank you for asking. Look, if they can do this to me, they can do this to President Trump, for God's sakes, the most powerful man in the world, and they did it with such gusto against him. They can do it to you and anybody else who's listening. So I think people really need to get involved, and they need to say no. This is the most un-American thing imaginable, weaponizing the government against its own citizens, and this cannot be tolerated. So please go to www.dropthecase.com, my website. You can follow me there. There's a give, send, go. If you can afford to give, I'd really appreciate it because this has nearly bankrupted me. And if you have any questions, please reach out. I'm happy to answer any questions, to talk to you. But again, this is the definition of un-Americanness. And again, if they can do it to the most powerful man in the world, without question, they can do it to you. Why wouldn't they? So it's not just about me. It's about the fact that they can do this to anybody, and they obviously can and will do it to anybody. So please get involved, and please go to the website, dropthecase.com. Thank you so much, and God bless you all.